Can a prostate cyst cause high PSA? Imagine discovering your prostate health is more complicated than you thought. One question many men ask is whether a prostate cyst can cause a high prostate-specific antigen level. The answer is yes, but with some important details. A prostate cyst is a fluid-filled sac inside the prostate gland. These cysts are usually benign, meaning they are not cancerous. They can vary in size from tiny to quite large. When a cyst is large, it can sometimes cause an increase in PSA levels. PSA is a protein made by prostate cells, and its level in the blood can go up for many reasons. While prostate cancer is a common cause of high PSA, benign conditions like prostate cysts can also raise PSA levels, especially if the cyst is big. There have been cases where large benign prostate cysts have caused PSA levels to spike dramatically. For example, some reports show PSA levels reaching around 79 nanograms per milliliter, which is much higher than the normal upper limit of about 4 nanograms per milliliter. Interestingly, in some of these cases, only a small amount of prostate cancer was found, suggesting that the cyst itself was responsible for most of the PSA increase. The exact reason why cysts cause PSA to rise isn't fully understood, but it may involve disruption of normal prostate tissue, inflammation, or leakage of PSA into the bloodstream because of changes in the prostate structure caused by the cyst. It's important to remember that PSA can be elevated for many reasons. Conditions like prostatitis, which is inflammation or infection of the prostate, and benign prostatic hyperplasia, which is an enlarged prostate, are more common causes of increased PSA than cysts. Very high PSA levels, such as above 100 nanograms per milliliter, are more often linked to prostate cancer or severe prostatitis. Because of this, if your PSA is elevated, your healthcare provider will likely recommend further tests. These might include imaging scans or a biopsy to determine the exact cause. In summary, prostate cysts can cause an increase in PSA, especially if they are large, but this is relatively uncommon. PSA elevation from cysts can sometimes be quite high, mimicking levels seen in prostate cancer. However, other benign conditions like prostatitis and prostate enlargement are more frequent causes of elevated PSA. Remember, PSA alone cannot diagnose prostate cancer. It is just one piece of the puzzle. A thorough medical evaluation is essential to understand what is causing your PSA to rise. Always consult your healthcare professional for personalized advice and proper diagnosis.